we hear it all the time, or at least consistently. Oh, I don't want to start this just yet because I'm waiting on, XYZ of imaging. It's like, but if it's not really going to change the after effects of that, what is the point in waiting on getting some relief and getting on that right away, rather than waiting like the months, or who even knows, it could be a year more before you get that imaging. So why not start now and start to feel better, start some of that healing process? Why wait?
Okay, hello everyone, welcome back. We're doing another interview with one of our therapists. We have Michelle, who is our lead therapist as well. So I won't bore you guys with introducing myself every single time. I'm Lindsay, you know me by now. Michelle, why don't you go ahead and introduce yourself real quick?
Yeah. Hi guys, I'm Michelle. Most of you have probably seen me around. I've been at the clinic here for about 3.5 years. I'm the lead therapist at Competitive Edge, and I'm an athletic therapist, so I prefer to work with people with concussions and motor vehicle accidents. And just with my own journey, I've had some hip and low back pain, so that's what I tend to look at most. And I still am an avid ringette player, and as most people know as well, I have a few dogs and I compete with them throughout Canada in dog shows. So that's my fun facts for you all.
Just a few dogs.
Just a few. Only 2 at my house.
Yeah, at your house now.
Yeah. My parents have like 5.
A lot of dogs.
Yeah.
I know that we're going to get this question. So can you tell them what a lead therapist is and what that means and what that looks like for you?
Yeah, so as the lead therapist, I get to help train a lot of our staff, get them through our orientation process, but also we get to work through different topics. Sometimes they'll get some individual one-on-one time with myself, but I also get to plan a lot of our meetings and a lot of the things that we do around here at Competitive Edge. We try and do something once a quarter as a team, just for team building stuff, so that we all, can get to know each other. We all are getting along, and just something fun for us to not have to think about work and take our minds off of that day-to-day stuff, and just keep the momentum going of how we are here on an everyday. So.
Yeah. So team building and mentorship and just overall checking in on everyone.
Yeah. And then also, going out into the community and seeing what anybody else needs, trying to stay involved with our at least athletic therapy university that's in town here at Mount Royal. And it would be nice to maybe go visit some other places as well, just to share that, now that we're a multidisciplinary clinic, share a little bit more about us and what we're looking for in people that could join our team.
Awesome. So let's jump into our topic for today. We're going to be chatting about imaging and why it's not always necessary and quite possibly not always beneficial. So can you just let them know what you mean by imaging?
Yeah, so imaging in the terms of getting an MRI or even like an Xray or something to that degree, which a lot of people end up having to wait months in order to get an MRI. If you want to do it privately, you can, but you're going to spend a lot of money, and a lot of time is not covered by any sort of benefits or insurance companies. So it would be coming directly from your pocket. So that's why most people tend to wait.
And why do you think it's not always necessary?
I think it's not always necessary because, we can assess a lot of that stuff on an appointment. At the appointment, we can get a really good idea of what's going on there. But sometimes what also happens is it can instill a little bit of fear. There's a lot of emotion wrapped up around it. And really, is it going to give you a good indication of what's going on with you? Because a few people off of the street and did the same imaging, we might find something very similar in them that's happening with you. The difference is someone's exhibiting pain and someone's not, and you're still able to live about their day-to-day life. And that's why it's sort of like, do you need imaging or do you not? Like, can we still get the same results? Because at the end of the day, is it going to treat, or is it going to change your treatment plan or my treatment plan for you going forward if we get that, all of that information?
Yeah.
So there are times, and it's not to say that all imaging is bad, but there are times it's like when, you know, maybe the stars don't align or things aren't progressing as you would expect or anticipate with a client or within that recovery process. That's more the time when I think it's a bit more accurate to get to that idea of what's going on a little bit further.
Yeah, if it stalls, that makes a lot of sense.
Yeah.
I just want to back up because you gave so much gold in what you said right there that I just want to like back up and drill some of it home. At the beginning, you said the imaging isn't always necessary because a well-trained therapist can tell what the injury is without needing X-ray vision to see through your skin. You know, and most people don't realize that, just the power of a therapist and a therapist's hands and a really good assessment by asking questions and seeing how you move, hearing what happened, and also feeling how the joint moves. There's different special tests, we call them, where you're testing the joint, you're moving the limb, and we can actually feel what's going on. Most people don't realize that. It's sort of like once you hone that sense, you know, it's sort of like unlimited. We can feel so much that's going on in the body underneath the skin. We can feel fascia, we can feel muscle, we can feel bone, we can feel ligament. And a therapist that's been working on their sense of touch for years and years can feel that ligament and can tell you whether it's torn or partially torn or not torn at all without needing that imaging. And you can likely get in for an assessment with a therapist a lot faster than the imaging.
Yeah, and that's why it's like we hear it all the time, or at least consistently. Oh, I don't want to start this just yet because I'm waiting on, you know, XYZ of imaging. It's like, but if it's not really going to change the after effects of that, what is the point in waiting on getting some relief and getting on that right away rather than waiting like the months or, you know, who even knows, it could be a year more before you get that imaging. So why not start now and start to feel better, start some of that healing process? Why wait? I don't think we need to. Like, start now, be proactive, and we can start getting you achieving your goals and getting you back to the activities that you love to do that you can't do when you're experiencing that time where, you know, you're having that pain or that dysfunction.
Love it. Yeah, why suffer unnecessarily when a well-trained therapist can tell you what the injury is and can give you a plan to resolve that pain and get you back without waiting for so long. Love it. And then
the thing that I love about what we do is it's a individualized approach as well. It's not like, oh, you have, you know, a rotator cuff tear. Well, here are the, you know, rotator cuff like exercises for you to do. This is all you're allowed to do for right now. It's like, no, let's look at what works for them. What are their goals and how can we get them back in a, you know, effective and safe manner.
Yeah. The other thing that I wanted to go back on that you had said originally is that if you take, I forget the example you used, but you take random people off the street, they might have the same result on their imaging without pain as you have on your imaging with pain. So can you just talk a little bit more about that and how that happens, how, you know, people can have this thing going on and be absolutely pain-free or be painful? Why does that happen?
It can happen for like a number of reasons. It can come down to your activities, your lifestyle, what you even do for work, or, you know, the amount of repetitive motions that you're going through in a day. And if you've had a number of other injuries that are in you know, a different region than where you're feeling that pain, it's not abnormal where your nervous system can also just be on such high end that where you're maybe displaying that pain is not necessarily because that's the root cause. It's likely stemming from something else. So that would be something that, you know, we could evaluate relatively easily from a therapist standpoint and take all those points into consideration. But also, like, there's a lot of emotional tie to people's pain and their suffering. And so it really depends on how much you're relating that into what's going on with that injury. So, like, you know, if you have a rotator cuff, you know, ache or pain, or maybe you do have a rotator cuff tear, like, a lot of people will maybe suspect that, but then once they get the imaging, they're like, oh, you know, it's this, I can't do anything for that, and I'm always going to be this way. And it's like, it doesn't have to be that way. There's plenty of stuff that we can do to help get that tissue stronger. Don't feel like once you have that definitive answer that there's nothing you can do, this is what it is, and you know, this is me now. People don't have to feel that way. They should be able to take that and feel more empowered and, you know, be able to work on those things. And whether or not you have pain or not, like I said, you could pick most people or some people off the street and they might have something similar to you, but the difference is you're experiencing pain and they're not. They might have a different lifestyle than you, and maybe that's why, but who knows what you can get. It's very interesting. I always say, like, it'd be fun to like do some imaging on myself just to see what's under there, but at the same time, do I really care? Is it going to change a lot of what I would do in my own, like, exercise programming and such like that? No, it's not going to change it. I'm still going to do those things and still work on, you know, building the foundation of, like, strength, mobility, appropriate flexibility, and making sure everything functions the way that it's supposed to, so that, you know, you can walk around and still do what you need to do in a day.
Yeah, absolutely. I talk about that same kind of thing in a couple other videos that we have up on YouTube. One is about arthritis and one is about having a shoulder tear. And I talk about the same thing where people hear, oh, I have arthritis, or oh, I have a shoulder tear, and they identify with that diagnosis like they're going to live like that for forever. And I talk about how a shoulder tear can heal and it can be pain-free, and arthritis you can have degeneration in the joint and still be pain-free. Like, the diagnosis doesn't mean anything. I find people think pain comes from the physical, like there's a tear or there's something wrong with the cartilage. They think of our bodies like a statue and like, oh, there's a defect right there, so that's where pain comes from. But it's like, well, actually, the pain is coming from your nervous system saying, hey, there's a problem over here. So you can have something going on physically and your body's like, oh no, we're fine, you know, and you have no pain. Or you can have a really ramped up body that's going, there's a problem here, like panicking about it, and you're in a ton of pain. So it doesn't necessarily matter what the imaging is showing to a certain extent. It matters how your body is reacting to that being there more than anything. Amazing.
No, 100%. And like you and I have like experienced in the past, like if someone's nervous system is like so on end with everything, you know, even going back down to like doing some simple muscle testing, like it might not be as beneficial for them at that point in time because their nervous system is just like, I can't do it. And then you have to do some different techniques that helps with bringing that down before then, okay, now we can do some of that and get down to the nitty gritty of it. And, you know, sometimes it doesn't take like a huge technique or a big release and, you know, just going to like, even just using a craniosacral technique, getting that to help down regulate the nervous system, and then going back and doing some of the other things, it can be so profound and so powerful for people to like make that change and just let them know that yes, you're experiencing pain, like your nervous system is also like super out of whack. We need to help bring those things together and help bring about your mental state a little bit more away from that area of pain. People get very focused on that spot that's really painful. Like you said, it like they identify with it sometimes, almost like, this is me now. And why should we have to identify to our pain? We shouldn't have to. We should be able to identify as a normal human being, like of the activities we like to do and such like that. Not, we shouldn't be limited or identified as, oh, Michelle has, a shoulder issue. She can't do this because, she's in pain all the time. No.
Yeah. I've told clients before that their nervous system was like a scared little deer in the forest, and it hears like a rustling and boom.
Yeah.
Yep. Man. Okay. Well,
Things about fight or flight.
Fight or flight. Yeah. Any last words about the topic before we give people an idea of how they can work with you or one of our therapists at Competitive Edge and sort of what to do next?
I'd just say, like, you don't necessarily need to wait to start getting, better or getting recovery. You don't need to wait before you start to see someone. Start seeing someone and be proactive about it. And then maybe by the time that appointment comes up where you're going to go and get imaging, maybe you're like not in pain at that point. So do you really need to get that imaging?
How great would that be?
So I think it's great to try and be more proactive about it. And I wish like a lot more physicians and such would actually prescribe some form of conservative treatment first, because they probably severely decrease their wait list on how many people will need to go and get imaging.
Yeah.
Like, how big would that be for the healthcare profession in general? Because maybe if we don't have this many people waiting on imaging, maybe we wouldn't have such a backlog, and we wouldn't have people having to wait for as long for it to maybe say, oh, there's a mild tendonitis forming there. Like,
and then at that point,
really
they say you need rehab, and you've been waiting a year. You could have started your rehab a year earlier.
Yeah, just let's see if we can make it a thing of start with conservative treatment and being proactive and possibly not needing the imaging that's going to show who even knows. Probably not a lot for some people that I've worked with. So
I feel like this is a whole nother topic that we could talk on for a very long time, but touching on conservative treatment, I think that's another thing that our healthcare system doesn't quite do as well as it could, is we go straight from imaging, okay, you have a tear, to, oh, you need surgery, or you need an injection, or something sort of invasive and traumatic on your body. I think, if we could make any changes we wanted to the healthcare system, it would be get rid of the backlog for the imaging by recommending treatment early and rehab early. And also, conservative options first before trying anything more extreme than that.
And even like, who knows, maybe we wouldn't need as many anti-inflammatories prescribed if we could start with conservative stuff that's not going to just be a band-aid.
Yeah.
Again, that could be a whole new topic for another day.
It really could be. So we'll start to wrap up here. If anyone is interested in working with Michelle, or wants some of Michelle's advice, or wants some advice from any one of our therapists within our team, I encourage you to go to our website. I'll leave it linked down below this video. Go to our website and request to speak with one of our therapists. You just fill in a quick request form, and then we'll set you up with a time to speak with either Michelle or another therapist that suits your needs, that can offer you some guidance and some advice. So if you're struggling with something and you think you need imaging, but you're not sure, and this video has made you change your mind a little bit, please reach out to us. We'd be happy to give you that guidance and help you make a good decision of whether it's worth waiting for imaging or whether you should just start with your treatment right away, so we can help you feel better sooner rather than later. Michelle, anything to add about if someone wants to work with you or with someone else from our team?
Yeah, I would say like we all take a very similar approach in how we come to the nature of that injury, and our team is like fantastic at being able to help to the root cause of your pain and injury. And by collaborating with one another, like I think we've done a really great job of getting so many people back to the activities that they maybe felt limited by doing, but they're also getting back into them and they're doing great. So.
On that note, if you guys haven't checked out the video that I did with Paul a little while ago, that's what we discussed about finding the root cause of people's pain instead of just slapping a band-aid on it, finding that root cause. And he speculates on what he finds is often the root cause of people's pain. So if that interests you, go check out that video too. Really fascinating talk with Paul. Okay. Any last parting words?
Oh, I could say so many things all the time.
I think that's a really good, like,
everyone is staying warm.
Yes. Yes, absolutely. Bring it on spring and summer.
Yeah, exactly.
Okay, well, thanks, Michelle, for your time, and thank you to everyone watching and tuning in. And I hope that you reach out to us for a little help and a little direction, and that we're able to set you on the right path and help you to feel better. Okay, bye for now.